Nurse Aide Test Prep Hawaii. Question 1. What is considered a normal blood pressure for an adult? Option A, 90/60ths mmHg. Option B, 110/70 mmHg. Option C, 130/90 mmHg. Option D, 140/100 mmHg. The correct answer is option B, 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60ths is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 2. The RACE acronym stands for: Option A, rescue, alarm, contain, extinguish. Option B, run, alert, call, evacuate. Option C, rescue, assess, control, evacuate. Option D, remove, alert, contain, extinguish. The correct answer is option A, rescue, alarm, contain, extinguish. RACE is the standard fire response protocol: rescue clients in immediate danger, alarm, pull the fire alarm/notify, contain the fire, close doors, and extinguish, if safe. Question 3. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A, ignore the difference. Option B, recheck it after 1 to 2 minutes. Option C, change the client's medication. Option D, document the first reading only. The correct answer is option B, recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 4. A client with dementia becomes combative during a bath. The nurse aide should: Option A, finish the bath quickly while being firm. Option B, stop and try again later when the client is calmer. Option C, restrain the client to prevent injury. Option D, leave the client without finishing the bath. The correct answer is option B, stop and try again later when the client is calmer. Forcing a bath on a combative client escalates the situation. Stop, assess the cause, and attempt later with a gentler approach. Restraint should only be used with an order and as a last resort. Question 5. Normal adult respiratory rate is: Option A, 8 to 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 16 to 24 breaths per minute. Option D, 20 to 28 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 6. When assisting a client to walk, the nurse aide should walk: Option A, behind the client. Option B, next to and slightly behind the client, holding the gait belt. Option C, in front of the client. Option D, far to the side of the client. The correct answer is option B, next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 7. A client with a history of falls has been repositioned. The nurse aide should also ensure: Option A, the bed is in the highest position. Option B, the room is completely dark. Option C, the bed is in the lowest position and the brakes are locked. Option D, the client's family is called. The correct answer is option C, the bed is in the lowest position and the brakes are locked. The bed should be in the lowest position to reduce fall injury risk, and the brakes must be locked. The room should have adequate lighting. Calling the family is not part of the safety routine. Question 8. What is the first sound heard through the stethoscope when taking blood pressure? Option A, diastolic pressure. Option B, systolic pressure. Option C, pulse pressure. Option D, pulse deficit. The correct answer is option B, systolic pressure. The first Kurokoff sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 9. When providing oral care to an unconscious client, the nurse aide should: Option A, brush the teeth vigorously. Option B, use a sponge-tipped swab moistened with mouthwash. Option C, place the client on their side and swab gently. Option D, skip oral care for unconscious clients. The correct answer is option C, place the client on their side and swab gently. Unconscious clients should be positioned on their side to allow fluids to drain, preventing aspiration. Gentle swabbing with a sponge-tipped applicator should be used. Oral care should never be skipped, it prevents pneumonia and infection. Question 10. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B, report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen. Question 11. A client who is agitated and wandering should be: Option A, restrained to ensure safety. Option B, redirected calmly to a safe area. Option C, left alone to tire out. Option D, given medication to calm down. The correct answer is option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 12. The chain of infection includes: Option A, pathogen, host, transmission route. Option B, air, water, food. Option C, bacteria, viruses, fungi. Option D, skin, blood, mucous membranes. The correct answer is option A, pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission. Question 13. To prevent skin breakdown, the nurse aide should: Option A, keep the skin clean and dry. Option B, keep the skin moist with lotion. Option C, rub bony prominences vigorously. Option D, use only powder on the skin. The correct answer is option A, keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 14. A client is withdrawn and refuses to participate in activities. The nurse aide should: Option A, force the client to participate. Option B, allow the client to choose and respect their decision. Option C, leave the client alone. Option D, tell the client they must participate. The correct answer is option B, allow the client to choose and respect their decision. Respecting the client's autonomy is essential. Forcing participation can increase withdrawal and anxiety. Leaving them alone may increase isolation. Offering options and allowing choice is the most therapeutic approach. Question 15. When feeding a client who has difficulty swallowing, the nurse aide should: Option A, feed them quickly to minimize aspiration risk. Option B, place food on the affected side of the mouth. Option C, place food on the stronger side of the mouth. Option D, use only liquids. The correct answer is option C, place food on the stronger side of the mouth. Place food on the stronger or unaffected side to help the client control and swallow. Feeding quickly increases aspiration risk. Placing food on the affected side can cause choking. Only liquids ignores the ordered diet consistency. Question 16. Normal adult resting heart rate range is: Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 17. When applying a gait belt, the nurse aide should place it. Option A, around the client's chest. Option B, around the client's waist, over clothing. Option C, around the client's hips, under clothing. Option D, around the client's neck. The correct answer is option B, around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck. Question 18. The nurse aide should document care. Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 19. Which task is outside the nurse aide's scope of practice? Option A, applying a gait belt. Option B, recording output. Option C, changing a sterile dressing. Option D, offering a bedpan. The correct answer is option C, changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 20. When taking a client's oral temperature, the nurse aide should place the thermometer. Option A, under the tongue. Option B, on top of the tongue. Option C, between the cheek and gum. Option D, under the arm. The correct answer is option A, under the tongue. The sublingual pocket under the tongue is the correct placement for an oral temperature. This area provides accurate core temperature readings. Placing on top of the tongue or between cheek and gum does not provide accurate readings. Under the arm is the axillary method, not oral. Question 21. The Heimlich maneuver should be used when a client, option A, is coughing forcefully. Option B, cannot speak, cough, or breathe. Option C, has a minor cough. Option D, is having difficulty breathing. The correct answer is option B, cannot speak, cough, or breathe. The Heimlich is for severe airway obstruction when the client cannot speak, cough, or breathe. A client who is coughing forcefully can still breathe. Encourage coughing. Question 22. A client who is confused becomes agitated. The nurse aide should, option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C, use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 23. What should the nurse aide do if a client begins to choke during a meal? Option A, call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B, perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 24. A client with dementia has difficulty eating. The nurse aide should, option A, feed the client quickly to ensure adequate nutrition. Option B, allow plenty of time and provide cues to eat. Option C, puree all food to make it easier. Option D, skip meals when the client is resistant. The correct answer is option B. Allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example, pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 25. Range of motion, ROM, exercises are performed to. Option A, build muscle strength. Option B, prevent contractures and maintain joint mobility. Option C, increase weight. Option D, decrease appetite. The correct answer is option B. Prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility.